What happens when two of the most plugged in people in digital care team up to help you make sense of the chaos? Welcome to Control Plus Care. I'm Michelle.
And I'm Katie.
This is your weekly briefing on the most important digital care updates. We're unpacking what you need to know this week in under 30 minutes. But first, Katie, how are you?
Yeah, I'm pretty good. A bit discombobulated. We're heading up to October, peak conference season. But doing well other than that. How about you?
Yeah, similar. My inbox at the moment is a lot of, have you booked this? Have you got a table for this? Be here at this time. Obviously,
hmm
ignoring all of it until the day before I've got to be somewhere.
Day before, pretty good for us. I know that both of us are definitely guilty of booking hotels in London when on the train
Yep.
to a meeting in
100.
London. So, as people who are perpetually over prepared for work and under prepared for the logistics around said work, I take.
Absolutely. And I think that's probably the right way round.
Yeah, it's fine. We're
I
fine.
say that because that's what we've got. Anyway, so yes, we are. Over the next month, you'll see us looking more and more dishevelled from various hotel rooms around the country. But that's good. We love October.
We
By
do.
the time we get through October, we really love November.
Looking forward to some rest and relaxation then. But yeah, if you want to meet us in person, we will be at all of the things over the next
Yes,
month,
we
but
will.
still be doing the podcast around that.
Absolutely. So do drop us a line. Let's grab a coffee. It'd be really great to catch up with so many of you. Now, on to news. So
hmm
before we start, actually, we record these in advance, and this time last week when we were recording, obviously the big tech news was the signing of the trade deal with the US, and we touched on it because it was just literally the start of the conversation when we were recording. We are absolutely going to be picking that up in more detail. The conversation around it has exploded, and rightly so. I think the implications of it for the entire country, not just social care, are worth us diving in. We've not done that this week, but we are absolutely going to probably touch on it in a bit more detail next week or the week after.
Yeah, exactly. We just didn't want you to think we'd somehow missed that from happening, but we will come back to it.
Absolutely. So this week we are, as always, diving into some of the stories that we've come across. And my first one this week is from RE State or Restate. I'm not sure how they pronounce it. And they've produced a report on operation automation. So how to achieve productivity gains, particularly in the healthcare system through automation. So big klaxon. AI is the big talking point for us all of the time. And when we talk about productivity and we talk about how we kind of reduce costs, reduce pressure on systems, it inevitably comes back to AI. And AI is a type of automation. But what we miss out is some of the other types of automation that I think absolutely would be fundamental. So there is, for example, robotic processing automation. So that's RPA. And that's robots that are programmed to emulate human actions. So they are interacting with digital systems to automatically do basic manual repetitive tasks. So this could be something as simple as appointment scheduling, or it can be generating reports. Finance operations are a really good one for this. So it doesn't have to be a physical robot in terms of like we all see like an Android type thing. It is more that the program itself does that action that is being done by a person.
hmm
The other one is intelligent automation. So this is the integration of robotics, which is those basic tasks, with intelligent systems. So this increases the scope of what automation can do beyond a kind of if, then, when rule-based task. So this is where your kind of chatbots often will come into. So FAQs, customer assistance. For us in healthcare, it's things like patient admissions, it's enrollment into appointments, it's theatre scheduling, those kind of things where the system is doing the booking, but to do the booking, it's got to kind of look at a system and find gaps and that kind of thing. And then we have obviously AI as, in this case, the human intelligence and cognitive process kind of replication. So this is data analysis, it's triage, it's fraud detection, it's risk management, it's imaging, particularly in health. And those three types of automation in combination, really, this report sets out that there are clear and significant benefits. We know that the health system is under enormous pressure. We do not have any new big resources coming anytime soon. So, starting to think about some of those systems within healthcare whereby automation could really help. So, there are already things going on in pharmacy, for example. Last year, I went on a visit to Liverpool Uni's robotic centre, and they had a full end-to-end pharmacy robot.
Hmm.
And it did everything from it took the prescription, it could count the medication, it could quality check the individual tablets, it could then do those double checks. And this was obviously in a lab environment, but that is being developed at the moment. My cousin, who is a pharmacist, is not a fan. But also things like pathology. All of those tests that are going on, how much of that is needing to have a person involved and how much of it could be automated. These are places whereby it could be really cost effective and efficient for us to think more on this. As ever, there's always that caveat, you know, is the tech up to scratch? Are we really in a place where we can trust automation without that human oversight? I would say probably in most cases, not yet.
Mhm.
But I'm never in favor of any tech that takes the people out the system. I'm always in favor of the tech being there to take the kind of drudgery out of the job so that people can do the thinking, so that people can do um the more creative aspects, the more human aspects of jobs. And then, obviously one of the things they flagged is pathology, and we know that the Synovus attack last year was particularly on pathology. So all of that data, we've got to be really mindful. The more we automate, the more we make things entirely digital, the bigger the risks are if there ever is an incident. And we need to make sure that our security, our kind of resilience is there, but also our response is adequate, that we don't find people falling through the cracks. Or, as in the case of Synovus, we had a death that was kind of
Mm.
attributed to that incident. So I think it's a really interesting conversation. The report, I think, is a very optimistic one, if I were
Mhm.
to be really honest. And it certainly left me with a lot more questions than it answered. But this is the direction of travel, Katie. We hear it all the time.
Yeah, we absolutely hear it all of the time. And, I think what I liked about the report is this is very sort of looking at the outcomes that people are trying to achieve, looking at those pain points and then applying technology to them. Like if you look at sort of, patient admissions within the healthcare system and how long that can take, and it doesn't really need to have sort of a person doing that same manual task over and over
Mhm.
again. And you then like apply that to the social care system, and you can look at doing exactly that same sort of thing for care home occupancy. For example, loads of care homes are getting requests all of the time. Do you have any beds? Do you have a waiting list? Is there anything available? If you could take some of the burden of that early stage conversation off your hands, automatically send over price lists, like whether there's any availability, whether you have options for a waiting list, so that you then, it's only when somebody is very serious and is like, actually, yes, you do have availability. Yes, they are actually ready to move. Yes, they do meet certain criteria. Then you have that conversation. You talk about contracting. Like that could be really, really powerful in terms of making sure that the conversations you're having are meaningful with people who genuinely are like looking for care, as opposed to sort of just sending a sort of, oh, this is our handbook, this is our website all of the time. I think there's a lot of opportunities here. And so then when you're looking at it from that very much, okay, what is the outcome? What are we trying to solve? Then you see these applications really taking shape. I think comparative to some of the other AI stories that we've talked about a lot in the
Mm.
podcast recently, which have been very much like, we have AI. How do we apply it?
Let's
This is
AI more.
exactly. And you're like, for why? For what? This report has a lot of the
Yeah.
for why and for what, which I think is really, really okay, the direction we need to be thinking about around this kind of technology.
Yeah. And I think, that point you make there around like the outcomes base, like what are we trying to do? And almost at that point, there's a binary. Do we solve the problem needs solving regardless? Is tech
Hmm.
the solution or is not tech the solution? And then we have the conversation and we weigh the two up. And, probably in a lot of cases, we're going to find a place that sits in the middle.
Yeah.
We're not having a big swarm of robots coming to run our hospitals, but we are probably going to have a team of people who are supported by really appropriate tech.
That's it. And this is also my so I've never figured out a way to do it because it just sounds so boring, but I think it'll be really, really helpful. Like, stick with me. So I do think there needs to be some kind of training or support for care organizations around process mapping. actually mapping out what do you do every day? What are the exact steps that you take to do every single task, which is, done in your service every day? Because it's only when you know what those are that you can start looking seriously about which ones can be automated and which ones can't. And
Mhm.
so one day, when I think of a better way of saying this is a course for process mapping, I think that would be really helpful for people.
I instantly don't want to go on that course, Katie, and I
Yeah,
know how useful process mapping is.
exactly. I don't want to develop it because of the name.
But again, it's this thing of like really digging into where are those pain points?
Hmm.
What are the potential solutions? And then what is the best solution? And why is that the best solution? Because I think sometimes we say we can solve that with tech, and you go, well, why is tech the best way? And when you understand that answer, you do two things. A, you give that tech a chance to really take hold, and
Hmm.
you give people a reason to buy into it. We hear all the time people saying, "Oh well, I'd buy in this system, but the staff won't have it. The team won't adopt it." Well, yeah, because they don't understand why, other than you saying to them, this is going to cut down half of my costs and I'm not going to need to pay you guys as many hours. Yeah, I'm not on
Hmm.
board with that either. But if you do, as Katie says, this process map and this kind of like, here's all the things, people are going to be able to draw big red circles around the bits of their job they never want to do again, solve them, and suddenly the team are on board.
Okay, so next story, going in completely a different direction for this one. So, this was actually sent to me by Kat Hall from the
Ah.
National Care Association, and I just think it's a really exciting thing. So, this is news from Camden Council. They're going to be the first council in the entirety of the UK who is going to be running a AI-enabled participatory democracy process to look at their health and social care system across Camden. So, for people who aren't familiar with participatory democracy, it's not something we talk about all of the time, sort of, I think, as a society, not just we've never mentioned it on the podcast, but, socially we don't all the time. So basically, it's a system of governance that enables community members to have direct involvement in decision making processes. So rather than electing an official or a councillor or something who then makes decisions on your behalf, it's individual members of the public who give their opinions, normally on sort of draft policies and that sort of thing, and sort of is meant to empower people to have more direct engagement and involvement in decision making in their communities. And particularly, I think around something like health and social care and such a impacts on every single person in the country, it's a really, really good sort of area to think about participatory democracy in. So the way that they are going to be doing it is that anybody who is over 16 who lives across London Borough of Camden is going to be able to take part in this over a 6-month period. People are going to be able to use in person forums as well as digital technology to take part in all of this work, which I think just means it really opens it up to people where they are. So we worry about digital only participation, that excludes people who aren't accessing the internet, for example, aren't using digital tools. And you don't have to have current experience of the health and care system to take part. It's about sort of getting everybody within society to sort of think about what it looks like for their communities. And I'm quite interested in this as a concept as part of the work I've been doing with Institute of Ethics and AI. We've been working with Stanford and their AI deliberation platform to actually use AI to enable lots and lots of small groups of citizens to talk about responsible AI usage at the same time in small group settings in a way you couldn't have that many moderators working at the same time to do. And I think this increasingly could be a way of getting sort of people more engaged and more involved in really sort of having a say in what the health and care system looks like. And I just think it's a really exciting thing for Camden to have done, and how amazing to be the first council in the country to do it.
It's really brave.
Really brave.
Really brave. Having been involved a long, long time ago in a lot of local politics, I could list you the people that I don't want responding to this, and there's this kind of tension in that we aren't used to doing this.
Hmm.
So, from a utopian future, everyone having their say, sings to my heart.
Yeah.
From a, I know the kind of people who reply to consultations, and really make sure that their say is heard. There's got to be a lot of work done to get everybody feeling confident to reply and have the time to reply to something like this. So I'm going to be really interested to keep an eye on how they actually go about this and what the results are, because health and social care is something everyone has an opinion on.
Hmm.
It is something that is tied to everybody's life, and the stakes are so high for so many people that the more people you get involved in these conversations at a time when health and social care arguably is probably right now changing more than it ever has in the last 100 years. You know, since we stood the NHS up, this is the biggest crunch time for us. This is where we either continue to have an NHS or not. This is where health and social care as a system either comes together as a system or diverges further. Um, and at a time when people need it more than ever.
Mm.
So really exciting, and I'd love to speak to the people at Camden who are kind of championing this, because this is a brave thing to take to a council. Um, and I'd be really interested to see where it falls, because if they get it right and this could be something that's replicated elsewhere, that's really exciting times.
Yeah, so I think we definitely need to reach out to Camden Council. I think it'd be really good to understand sort of how they reached the decision about sort of taking this approach and sort of how they chose their partners, because I assume they have a partner who is supporting them with the development of this
Yeah.
platform and everything. And I just think, being quite interested in the concept of participatory democracy and particularly how AI can enable it and enable people to be more invested in their society. Because I think we talk quite a lot about how AI can make people less engaged. It's like, actually, how
Mhm.
can it bolster engagement? For people really interested in this, Audrey Tang writes a lot about it. She was the first digital minister for Taiwan, also works at Harvard and Oxford University as well. So, yeah, really interesting stuff.
Very brave. I like it a lot. I mean, we are sticking around the local government area of the world, but we are coming to my hometown. So, released this week, I'm always proud of anything Liverpool does. We can do no wrong. Liverpool City Region have done a big piece of work around digital inclusion. So they have a digital inclusion network that has, I think, about 200 organizations involved. And the big thing they're trying to tackle is digital poverty, which is something, Casey, you and I have talked about at length, especially amongst our social care workforce. So the kind of stats around digital poverty, and for anyone who doesn't understand, that is the access to, whether it be broadband, devices, data, people who cannot get online because they just simply can't afford to or don't have access to it. It affects around 15% of UK adults and 20% of children. So it's not an insignificant problem. This is not a niche thing.
Mm.
Many, many people in all of our communities are affected by it. And also in social care, where we know that our workforce typically is living either on the breadline or beneath it, are going to be numbering in this. And then those people who use our services similarly. So for the Liverpool City Region, they reckon about 127,000 people remain offline. And they are the people who need to be online more than ever, because it means they've got barriers to education, employment, even things as simple as social inclusion and shopping. There are areas of Liverpool now where there is no supermarket and there's no high street. And if you can't then also shop online, you're in a real kind of food and resource desert.
Mhm.
So the Combined Authority has invested significant money. It's 1.4 million in improving what they call digital hubs. They've signed the government's IT Reuse for Good charter. So, when devices kind of get to the end of their working life, either in the council or in an organisation, they can then be taken by who is it? Who does it? Might be the Good Things Foundation, but I'm not sure. But basically, they kind of
Mhm.
take them, wipe them, and then give them out to people that actually need them, keeping them in the economy and out of landfill. So they've now created this guide, and it's like 84 pages. It's got everything you could possibly need to know for people who are offline, and importantly, it's also advice for people who are already online how to do it better. So it's how to apply for jobs, how to manage money, how to avoid scams, which is music to my ears, how
Mhm.
to spot misinformation. We know we live in an age of, well, I saw this thing online that said, I mean, the latest one is coming out of America is paracetamol causes autism. I mean, that is from the president. That's really hard to spot that as misinformation. But this does give you advice. Don't be taking any health advice from anyone except the NHS website. And it's supposed to offer simple step by step advice, but it's comprehensive and it's free, and they've made it as accessible as possible. It's in schools, it's in libraries, it's in doctor's surgeries, it's everywhere people already are going. And I just think anything that really starts where people already are and tries to
Yeah.
take down some of those barriers can only be a good thing.
I didn't really have anything to add on this one. I
Yeah.
just think it's an amazing initiative and it just can help so many people. So it's so fantastic.
Yeah. Nice to see. Nice little good news story.
Yeah. So you were not always like really negative on this. You have some good
I
news as well.
think we give ourselves a hard time.
Definitely.
Someone should.
If you listened to podcasts last week, you'll have heard that I was in Ireland for the Nursing Homes Ireland conference, and I have been through a rapid learning curve of everything about care in Ireland. It's been
Amazing.
absolutely amazing. So I wanted to sort of bring one of the reports, which actually was published back in the summer of this year, but was there's a presentation on it by Dr. Brendan Walsh at the conference that I was at. And also, it was mentioned in basically every other conference presentation because it's having a huge amount of impact in nursing homes in Ireland. And I think it's a great story about the power of data. So, this is a report which has come out of the Irish Department of Health with the Economic and Social Research Institute. And it's looking at developing, well, it has developed the projections of national demand and bed capacity requirements for older persons' care through till 2040 in Ireland using a projection model called Hippocrates, which has been specially developed for sort of bed occupancy requirements, bed capacity and demand, not just in older persons' care, also they've done it in primary care and in some of the hospitals as well. But I'm just going to focus on the nursing home
Mhm.
bit, really. Um, and kind of what it's shown is there's a massive projective rise in the requirements for long term residential care potentially in Ireland. Because by 2040, 1 in 5 people in Ireland are going to be age 65 plus. At the moment, apparently, Ireland actually has the youngest demographic population in Europe, but
Oh,
it's
interesting.
aging rapidly. And they're going to also have a larger population of people aged 85 and older without having the younger population coming through. So,
Yeah.
very similar demographic challenges that we're having, obviously, across the UK and we're seeing globally as well. But I think what's quite interesting about them having this study through to 2040 and those predictions is obviously supports that long term planning initiative. You know, there was a lot of talk in Ireland about the need for high quality data to allow these projections to continue. A lot of conversations as well about what part of that capacity will need to be in actual residential care capacity as opposed to caring at home, the same conversation we are having here. I just think it's an interesting data model that they are using for it and a really, really fascinating report, which we'll link in the show notes as well. And it's also something which I know Nursing Homes Ireland, so they hosted a roundtable earlier this year and have developed an insights report really calling for sort of a national policy specifically for nursing homes in Ireland off the back of having these new data. Not just that, there's other elements that have gone into it. But just sort of, again, sort of shows that story about when we have access to high quality data, we can start having those long term planning conversations. We can start having informed decision making in what we're doing. And so to take it outside of the UK for once, we've had some Scottish episodes, we've mentioned Wales. Now we'll bring it to Ireland as well for people who are interested.
If anyone would like to invite us anywhere really sunny to
Oh
conduct
my
an
God, we
episode,
would
we are
love that.
also open to conversations around tech and social care in sunnier climes.
Hmm.
Just putting that out there. But back to this point, we always talk about data, and I think we kind of know intuitively that the picture is going to get bad. And there have been multiple studies that talk about, increase in need, older population, that workforce, the working age adults is collapsing. We're keeping people alive longer, but not well. Having something like this that actually says, here is the number and we can prove it and we can back it up makes a compelling case to government. And clearly it's working in Ireland because everyone's kind of sat up and said, oh, hang on, we don't just kind of know this is an issue. Now we really know that this is an
Hmm.
issue and we know the size and scale of the issue. And you and I both have our eyes firmly on our own old age. That's why we
Yes.
work in social care.
Uh huh.
Very,
We
very
want it all
selfish.
fixed by the time we're 85 plus.
Yeah, it's
It's all going to be seamless.
we're working towards it. We need everyone to get on board. But really, at the very bottom of it is that Katie and I want an easy older life.
Hmm.
Um, but we also know that by the time you and I get there, we are going to be in a sea of other older people who are still there. So need is going to have not just grown, but have ballooned. And systems need to be getting ready for that now.
Yeah.
And
I think that's
fancy data projections will help us make that case.
Yeah, it definitely will. And, I mean, I always say 85 plus because that's where we're at now. I think we should aim for 100, Michelle.
Okay,
Like, once we're
yeah.
100 plus, I
Well,
mean, on the clock
you and I
there.
are both investing heavily in our fitness regime, so we
We are.
probably are going to be, still lifting heavy at 85. Probably
I
dialing down.
always,
You'll be dialing down the CrossFit when you hit 100. I'm gonna.
yeah, possibly dialing down a little bit. Yeah, I always say at the gym, and people are like, why are you here? Are you wanting to, like, get fitter? Are you wanting to do, like, bikini body? I'm like, no, I just want to be able to get up when I fall.
Yeah,
That's
yeah.
what I'm aiming for.
Carry shopping up the stairs at 76.
Exactly.
I
Yeah,
am
that's the
training for my
long-term
old
goal.
lady body. I want these joints supple and moving right. Like the outside can look however crypt keeperish it wants to be.
Hmm.
I want these sockets to be well oiled. That's what I'm after.
That's it. I want to be able to stand from a chair on one
Yeah.
leg, balance golden. That's the
Yeah.
long-term goal.
We're not asking for much of that. And the solution of all problems in social care.
Yeah, it'll be
What
fine.
can go wrong with our plan?
See, I normally just say what I'm looking for is cross-border data sharing by the time I turn like 85, which feels more achievable than solving all of social care in that time.
I actually think cross-border data sharing might be unachievable for us. We might
Ah,
solve everything
no.
except that.
Nah, I have faith. As somebody who lives about 10 miles from the Welsh border, please.
Oh, so that brings us to the end of our news stories today, and we get to arrive at our favourite segment. So
Hmm.
this is our Cyber Squirrels. Now, normally by this point, we've kind of talked ourselves into a little bit of a pity party. We've not done that today, but we are still going to have a little segment which is dedicated to fun, light-hearted, positive tech stories that we found in the news this week. And this week, Casey, I believe you've got one for us.
I have. I'm quite excited about this. It makes my like little sci-fi nerd heart incredibly happy. And I'm going to caveat first by being I was like a Meta glasses hater. I was like, I don't want to have them in front of my face. I don't know why I want to have to be able to see texts in my glasses. I don't wear glasses, but should I wear glasses? I don't need that. But now Meta and also Ray-Bans and a couple of other companies have got sunglasses which have live translation software in it. So it will translate as somebody is speaking to you in a foreign language so you can hear it in your ears in real time. And also some of them, the other person can also have it showing up on a mobile phone so they can read the live transcription simultaneously. And this is Star Trek. This is
This
Hitchhiker's Guide to the
is
Galaxy. This is amazing to me.
I mean, it's incredible. And yeah, my mind goes straight to Hitchhiker's Guide to the Galaxy and the Babel Fish. And like, but is it the death of language or is it the preservation of language? That's like
Yeah,
that's the big question. Does it mean we all suddenly learn all languages and they all will start to meld into one? What was that? What's that language that everyone's supposed to speak? It's red. Here's my sci-fi nerd. Esperanto. The
yes.
invented language, Esperanto, which is like Spanglish essentially. Or would it be like suddenly Welsh speakers can just speak Welsh and not worry about being understood anywhere outside of the A55?
I mean, to give a really boring answer about this, so I guess it will really depend on the language size. So something like this is obviously trained on large data sets. So if you're speaking a
Mhm.
pretty rare language which doesn't have a huge amount of data sets on it, then you're probably putting other languages at risk of basically fading out because it wouldn't
Yeah.
be right for the translation software. I think there's about 6,200 languages in the world, and we're losing several hundred a year generally, which is sort of terrifying. But there is also sort of a lot of really interesting research happening around sort of mutual intelligibility. The Germans are doing quite a lot of this.
Mm.
So this is a outside of work, a special subject area of mine that I really find fascinating. So I think it's really hard to know where it can go. I think in the short term, obviously, this can be, really help us on a holiday. But also, if you're working in an environment where lots of people have English as a second language,
Yeah.
can help with some of those conversations. So, I mean, right now, I can't imagine they're going to be widespread use given the cost of some of this technology
Yeah.
at the end of the day.
And
But
there are
we'll
like,
see.
and also there are other implications to using meta glasses. So you might
Yes.
have got them because you really like translation services, but you're also going to a school playground and recording what's going on. So, there are, meta glasses still give me the ick.
Yeah. I mean, is this the first Cyber Squirrels, though, that we've actually turned into the bad thing? It started out as the good thing.
Honestly, we're so gifted at this. We could take any tech story. We can fearmonger over anything.
Yeah,
Um,
that's not what this podcast is for, though. We just wanted to share the translation software.
the translation is really exciting, especially for social care, where language is often a big barrier. And I
Mhm.
think, this is one of those things, a little bit like the piezoelectric tiles from last week. It feels like it should
Yeah.
exist in the future. And here we are
Mhm.
today. And I love that little feeling of like, oh, it's here, it's tangible, it's a thing.
Yeah,
So yeah, really exciting, but another one to watch.
definitely. The future is now. Isn't that what they say?
Was that an advert for something?
Definitely an advert for something.
Probably some sort of technology.
Hmm.
We'll Google it and we'll put it in the show notes. We couldn't answer that question. Anywho, that is our roundup for the week. Come back next week where we'll be discussing the latest digital news in care. So what happens when two plugged in people team up to demystify digital care? You get control plus care.
Subscribe now wherever you get your podcasts, and all of the links mentioned today will be in the show notes.
And tell a colleague, particularly if they too are desperately awaiting the invention of a real life Babel fish.